cleft lip is basically the failure of the two halves of the nose and the palate and the lip to completely form and move into place. If it's the right half, then it becomes a right cleft lip or palate. If it's both halves, then it becomes a bilateral cleft lip or palate, or vice versa, a left. Most often in the US, cleft lip and palate is detected via a prenatal ultrasound.
So at about 21 weeks, at the anatomy ultrasound, they found that he had a bilateral cleft lip and probably palate as well. So at that point, we were, referred to another doctor for high-risk pregnancy and things like that, and told to seek out a surgeon for when Nolan was born.
In baby Nolan's case, this is his nasal alveolar molding device that we created with one nasal stent on either side to help improve the nose on either side of the cleft lip. And then there's an area back here where the palate and the nasal septum is sitting. Nolan wore this device for about 10 weeks prior to surgery, and each week we made small adjustments and manipulations to improve the shape and projection of his nose and improve the position of his nasal septum.
Dr. Trovato told us about the NAM device and how it would basically move that piece of Nolan's lip into place before surgery, so that when they did surgery, it would just be stitching everything together as opposed to having to move the piece of his lip into place. So it would be a lot easier for him in recovery and just yield a better outcome as far as scarring and surgery went. I would absolutely recommend using the NAM device, and it made such a huge difference in how he looks now. I mean, there are times it was super stressful, very emotional, but everything turned out wonderful. We couldn't have asked for a better doctor in Dr. Trovato.